Hi, my name is Anna Sata, and I want to give you a little bit of information about the potential for useful information using the Intelligence panel. And in this scenario, I'm showing you the results of a neurodevelopmental panel. And this is a sample report that is from a 6-year-old who had autism spectrum disorder. And she also had issues with anxiety and a lot of GI issues, intermittent diarrhea, and a lot of her symptoms would get worse whenever she had an infection or if she had sometimes at random where the parents couldn't really figure out what the trigger was. And so they had done a genomics test to try to get more insight into what to do about it. And these are the results. And it's a pretty in depth test because it starts looking at gene variants that we know are specifically associated with autism, but there are genes that are associated with folate receptors, and there are genes related to PANS and PANDAS, which are neuropsychiatric conditions that seem to be associated with infection. There are genetic variants that play a role in attention and focus, on stress and anxiety, as well as a lot of different nutrients and how those nutrients are transported through the body. There are ways of looking at how good your body is at clearing toxins, histamine response, which is an exaggerated kind of allergic response. And so there's a huge amount of information in here. And if you open up any one of these panels, you can see that there are potentially dozens of genes that are involved. And so you have to figure out, well, how do you find the genes that are the most relevant for any particular patient? And one thing that's really nice about Intelligence is that it gives you the frequency of the genes. So you can find those things that are the most unique about your particular patient. And in this patient, the thing that popped up actually that was the strongest contributor, or at least the most unusual thing about her, is actually in the inflammation panel and not in the autism panel. And if you open this up, there are a lot of genes. And the way this is organized is it's giving you the specific gene here, plus it's telling you the frequency in the population. So in this case, she has 2 copies of the GG variant of a gene called CCL2, and that's only present in 8.8% of the population, and she has 2 copies of it. And this red color just means that it is a fairly clinically significant gene, that it leads to at least a doubling of your risk of a particular condition. And then you can find out more information about what that does and potential interventions. But I want to go down to this one. This is TNF alpha. And she has 2 copies of this gene variant, which is only present in 0.8%, so less than 1% of the population. She's here in this little sliver. And that gene variant causes her body to overexpress TNF alpha, which can lead to excessive inflammation. And when you have an overabundance of inflammation, then you can end up with more tissue damage associated with that inflammation. And that can lead to things like an increase in breakdown of the blood-brain barrier. So there's increased permeability of things getting across that barrier into the brain. There's also a higher tendency to have a breakdown of the gut barrier and the intestinal barrier, which is frequently referred to as leaky gut. And if that was it, then I think this test wouldn't be that useful. But if you can go through and say, all right, we know that's a weakness for this person, but what do we do about that? And then you can pull up interventions. And there are actually dozens of interventions. So you can use lion's mane, which is a mushroom, and it's been used in medicinal traditions for quite a long time. But when they've researched it, they realize it actually lowers TNF alpha, which is her specific risk factor, and it's able to get across the blood-brain barrier where it needs to do its job. There are some other plant-based compounds that also do that. You can look at curcumin, which is from turmeric, which is widely used as an anti-inflammatory. And magnesium threonate, which is a form of magnesium that helps get across the blood-brain barrier better. So phorafane is a plant compound from cruciferous vegetables, and you can eat cruciferous vegetables or you can take it as a supplement. And typically, if you had this level of gene variant, I'd probably recommend it as a supplement because it's a much higher dose. But it would be very safe. There are a lot of other things that have been researched. There are dietary interventions like capsaicin, which is from chili peppers, that helps lower that factor. Now, I don't know that you're going to get a 6-year-old to eat a lot of chili peppers, but if you had an older patient who had these same risk factors, that might be a good option. And then there are some potential prescription medications. So pioglitazone, which is an anti-diabetic medication, can at times be used. And so you get all sorts of research, and there are references along all of these to say, well, where did these recommendations come from? And I just want to show you a handful of these, because in this patient, that inflammatory gene was pretty unusual. She also had a gene called TRIM33, and that's up in the autism panel. And TRIM33, let me just pull it up. It is right here. So this causes your body to overexpress IL-17. And this is a level of detail that I think as a patient you don't necessarily want or need to have, but it's useful for your provider to know this stuff. And if you produce too much of that cytokine, then you will go on to produce too much TGF beta, which drives inflammation. And when we see that, then we say, okay, well, what do we do about that overexpression of TGF beta? And there are several things. So cinnamon helps to lower that. Narogenin, which is from citrus fruit, lowers it. Resolvins, which are downstream byproducts of omega-3s and fish oil, helps to shut down that inflammation once it's been triggered. And then there are different foods that you can add in. So you could customize a plan based on the specific genetic variabilities for any individual to try to get the best outcomes. I'll just show you one more example while we're here. This in the neurobehavioral panel, which is right here. And it involves a gene called GABR3, which, let me find it. Okay. So this has to do with one of the GABA receptors. And GABA is a neurotransmitter in the brain that's very calming. And so it's kind of that feeling like right before you're about to go to sleep and you just feel relaxed and calm. And so you want to have decent GABA signaling in the brain. And if the receptors for the GABA are impaired, and so you can't receive that signal to calm down, then that can lead to this overexcited state. And so if we see that she has some problems with that GABA signaling pathway, how do we address that? And there are a lot of ways we can do that. Taurine is an amino acid, but it helps to support or helps to stimulate those same receptors. And that's actually been used in some genetic syndromes where there's actually a complete deletion of this gene and not just a slowed down, less effective version of it. There are different probiotics, and all probiotics are not the same because they're all different species in the body, but Lactobacillus rhamnosum and Bifidobacterium longum have both been shown to increase GABA synthesis of this specific neurotransmitter in the GI tract. And then we know zinc is involved in the neurotransmission along this pathway. Magnesium helps to improve the expression of the receptors, so you have more people listening for that. And so if you have this level of detail, you can customize things. And you can look and see how they interact with each other. I said that was the last one, but I forgot. If you find the attention and focus panel, which is right here, this patient had a gene right here, this HTR1B. And this affects higher glutamate, which is kind of the counterpoint to GABA. It's the excitatory side instead of the inhibitory side. But ultimately, when you have this gene variant, it leads to lower GABA expression. And so now this patient has multiple reasons for the GABA, that calming sense, to be turned down and for the excitatory side to be turned up. And therefore, we can go in and we can say, well, how do we address this? And there are different nutrients that are helpful. So L-theanine is helpful as a calming agent and can help increase those GABA receptors. You can use N-acetylcysteine, which helps to lower the glutamate, which is the excitatory side of things. And I just really like the precision that this leads to. Um, if we go back to the case report and we just say a 6-year-old who has autism disorder and some gut and anxiety issues, and how do you treat that patient? It's kind of a black box. We don't really know. But when we have this level of detail, I think we can find a lot more precision in what we're recommending. So I hope that helps. Thanks.